I am living with type 1 diabetes, and so is my 15-year-old son, Zach. I want to share our diagnosis stories with you and talk a little bit about the ways that we can feel safe in our own environment. Until Zach started living with diabetes, I never realized how little the people in my life actually knew about my disease, how to help my lows, or even where I stored my supplies. Diabetes does not actually run in our family, so when I was diagnosed in 2001, it was a shock to all of us. I was a freshman in college, living in New York City, which was a big move from growing up in Seattle. I honestly felt fine, but I definitely had some symptoms without even knowing it. Rapid weight loss, always thirsty, and always tired. On December 24th, my face started twitching really badly. Turns out I was having a seizure, and my older sister Francine took me from my dorm room to the hospital, where I learned my blood sugar was over 1,000 milligrams per deciliter, and I was diagnosed with type 1 diabetes. I know, I am very lucky to be alive. My son Zach was diagnosed in August 2021 as he was getting off the bus from sleepaway camp. I had seen pictures of him throughout the summer losing weight, but we thought he was just getting taller. He didn't really have many obvious symptoms besides always being thirsty, and he felt totally fine. So when he got off the bus and he was 20 pounds lighter than when he left for camp, I immediately knew what it was. After testing his blood sugar, he was diagnosed at the hospital with type 1 diabetes. I'm grateful that he's been so calm and accepting of his diagnosis, and has never really been afraid to share with the people in his life, including his friends and teachers. Since before Zach was even diagnosed, he watched me openly sharing about diabetes and never letting it stop me from going after my dreams. So how can we empower the people in our lives to help keep us safe in treating severe lows? Gvoke HypoPen is a great example. When people think of diabetes, they might think of high blood sugar and using insulin, but they might not be thinking about what happens when our sugar goes low. Sometimes it's just a mild low, and we may experience signs or symptoms like irritability, sweating, and hunger. Milder cases of low blood sugar or hypoglycemia should be treated promptly by eating sugar or a sugar-sweetened product. But other times, blood sugar can become very low, also called severe hypoglycemia, which can be life-threatening. This auto-injector is a safety net to treat a severe blood sugar low, and anyone can administer it, even the patient in certain situations. It's one thing to have the pen in our possession, but it's another to make sure people know how to use it and know where to find it. To all those living with diabetes out there and parents of those living with diabetes, I encourage you to ask your healthcare provider about Gvoke HypoPen. Severe low blood sugar happens, and for me, peace of mind comes from knowing that there are safety nets and to teach the people in my life how to be prepared. We are not broken, and we don't need to hide our disease.